The Trump administration plans to send to Kenya U.S. citizens exposed to the Ebola virus rather than bring them home for observation and treatment, according to 3 people with knowledge of the plans. The approach is a stark contrast to the way previous administrations responded to outbreaks, during which healthcare workers and other U.S. citizens exposed to the virus were brought home to be treated at specialized medical units. The administration this month flew an American doctor who developed symptoms to a hospital in Germany and transported 6 other Americans for monitoring in Germany and the Czech Republic. The Ebola outbreak in the Democratic Republic of Congo is estimated to have ballooned to more than 1,000 cases and more than 200 deaths in just the 11 days since it was first announced, making it the 3rd largest on record already. Aid cuts by the Trump administration shut down crucial disease surveillance networks and medical supply chains that might have detected and contained the epidemic sooner. Last week, the Trump administration invoked a public health law known as Title 42 to bar immigrants and legal permanent residents who had been in Congo, Uganda, or South Sudan in the previous 21 days from entering the United States. The administration's new plan would also keep U.S. citizens who might have been exposed to Ebola out of the country, according to 2 of the people with knowledge of the plans, who spoke on condition of anonymity because they were not authorized to discuss the matter publicly. A few dozen public health service officers are now being trained to deploy to Kenya to provide medical care to Americans who are deemed at high risk of developing Ebola. The initial plan was to monitor those Americans in Kenya, but to move anyone who started to show symptoms for treatment in Europe. But the administration now plans to provide treatment in Kenya as well, according to 2 of the people with knowledge of the planning. Government scientists and physicians who develop symptoms will also be treated in Kenya. The administration is setting up a facility in Kenya where American citizens can quarantine or be treated through a coordinated effort with the state and defense departments and the Department of Health and Human Services, according to one of the